I actually got diagnosed with AIDS. I was in 1985. I was a heavy drug user, and when I found out, they only gave me 3 months to live. My thought is, well, if I've only got 3 months to live, I might as well just keep drugging. And I was drugging hard and everything else. In the meantime, after like 4 years, I figured I wasn't going nowhere. I also had 2 little girls. So I got myself clean. I got into a rehab and everything else. And so I was drugging from 1985 to 1996. I got into myself a rehab, and then I never went back. I'm still clean for like 25 years. It was hard, like when I first got diagnosed, but then when I started using drugs, it's like, when you're down using drugs, you really don't. And I kept going into hospital after hospital. When I got diagnosed, I only had 17 T cells. And in the meantime, I wound up in a coma twice. It was pretty hard from 1985 to 1996. And then when I was clean, it was a little hard, but not as hard as it was before. I came to the fact that it is what it is. If it happens that I pass, I pass, but at least I passed a clean life. I had no family support. First of all, I was raised by my great-grandmother, and she left when I was 14. And I've been on my own since I was 15. I have a mother that we didn't get along together that much. I have no siblings. And according to my mother, I deserve to get it because of my behavior. So the only support I had was my 2 daughters at that time that was young. And that's the only one, and they're too young to understand anyway, I got married in 1996 to a woman who was negative and didn't know anything about the HIV. And that was hard to me to explain to her. But that was rough, but then she decided she wanted to be with me. And then we started going to gay men's health crisis for positive and negative partners. So that helped me, I helped her understand it. And we were together like for 15 years before she passed. The only support I have right now is that I remarried. We've been together for 6 years. And she's been there through thick and thin. She's been there through my transition surgeries and everything. But that's the only support personally that I have is my wife that I have now. I've been an activist since 1996. I started out working out with Body Positive, the magazine, which is no longer there. And then from there, I moved on to Gay Men's Health Crisis because I needed to learn more about the disease. And then from there, I did the peer education training, and I became a peer. And then when I started to understand more, then I did a little bit of advocacy for helping the new people who was just newly diagnosed. At that time, there wasn't too many trans. I didn't know too much about trans. And I worked there like for 3 years. So then when I moved on to 8 service centers, that's when I started to know a little bit more. And then obviously when I went to Housing Works, that's when I was under the complete of an understanding because I started going to the trans group and everything else. So when I got to Housing Works, that's when I really got into the trans advocate and everything else. I came a long way with the help of the agencies in it. Without the agencies, I don't think I would have been here. The biggest difference between the trans men and the trans women is that the trans woman is more known to get HIV, but whereas a trans man, there's not that much advocacy in trans men because they feel like trans men don't get HIV. But a trans woman, they always focus on trans women. They need to focus more on the trans men because trans men are HIV. Me, for example, I'm a trans man. I got infected by IV drug use. So what I'm trying to say is there should be more advocacy for trans men, like we're in the background. Being trans and medically transitioning, whatever, you gotta choose and pick because a lot of doctors really don't understand even though they say they do. Nurses in the hospital, like for my transitions care, whatever, I go to a transitions doctor and transitions hospital and everything else. I don't know if they do understand. Me personally don't feel comfortable revealing that I'm trans to when I go to my primary care, or if I'm in a hospital, whatever. Me personally, I don't reveal. I'm just male. My birth certificate, my passport, everything is changed, so they wouldn't even know. I don't feel comfortable because there's still a lot of ignorance in the healthcare. It's dangerous for trans women, and it's also even more dangerous for trans men. You know, if you're in a hospital, in a healthcare facility, that they don't understand, you know, you get a chance of getting hurt, you get a chance of being ridiculed and whatever. So even where I live at now, nobody knows. It has come a long way, and I think it's still getting better. It's still getting better, and it's better, especially for the young trans who are infected. They don't have to be hiding, or they don't have to make believe they're lesbian when they're not. I wish somebody came out to me as a trans when I was, you know, much younger. So the difference we're making right now against AIDS is that we're more visible, we're more accepting, and you got our trans community that if you're lost, that's one thing about the trans community. They will support each other to the end. They will.